was 18, I had no idea what I wanted to do.
I don't remember really having any idea or even thinking about what I wanted to do when I was older.
I wasn't sure exactly what I was going to see myself in, but I knew that I wanted to go to college.
High school, when I was in high school, I had never heard of epidemiology. I had maybe barely heard of public health. Usually it's used in a negative connotation.
I wouldn't have known what a public health nurse was.
I didn't actually know it was quite possible to have the job that I have now.
I chose prevention because I want people to have the highest quality of life possible. My job is complex and it's diverse. My main responsibility is developing employee wellness programs for Franciscan SCEMP employees and also for area business customers. And that means everything from consulting to program development, implementation to marketing, communication, program evaluation, outcome measurement. I spend a lot of time working very, very closely with my team of other health promotion consultants. I'm involved in every single aspect. There isn't one thing that comes out of my department that I haven't touched.
I coordinate a program that provides medical outreach and other forms of outreach to underserved communities. As a project manager, I'm responsible for keeping 20 balls in the air at all times. Most of my time in my role is spent at Gunderson Lutheran or in the La Crosse area, meeting with individuals, working on those administrative tasks in order for the program to operate smoothly. Occasionally I do have the opportunity to travel. I travel with the team, help be the liaison for the providers and the nurses on the team, and just ensure that the clinic operates smoothly, that the volunteers know what they need to be doing, working with the patients coming in the door, and just acting as an overall coordinator for the team.
I apply biostatistical concepts at the Gunderson Lutheran Medical Foundation in La Crosse. One of the things we try to do as researchers is improve outcomes of people. Another thing we try to do is simply shed light on what's happening with certain diseases. We monitor and we use statistics to do the monitoring. We can't come up with these kind of analyses that we do without technology. It's essential. I work with cancer studies that are geared towards lung problems. How long does a person live? Design is a major issue. How we design the study and what results we have to be conveyed correctly to our audience. One person said that I keep him honest. I kind of smile at that because it's kind of true.
I coordinate events for the Y. Some are adult focused, so like the Got Energy Triathlon that we have every year. I also organize many events for children as well, like a Hippity Hoppity Easter Boppity, a kids triathlon, and a Rudolph Dash. By getting sponsors and things like that, I get to go out into the community and meet a lot of our community leaders. From that, you're able to start coordinating, figuring out like your location, time, and place, getting some good people on your committee to help plan it, and then also just making sure you're reaching out and getting the word out there so people know of the event.
As a public health nurse, there are many different things that we do. We have many different programs. We work through the health department so we can provide services to people in the community. We work with children with special health care needs, maternal child health programs. We follow up with people who have been diagnosed with a communicable disease. We've been doing a lot of foot clinic. Another service that we do quite a bit is giving children immunizations.
One of my top job functions is to just watch the number of reportable diseases as it goes week by week, month by month, year by year. Epidemiology is all about the study of disease and how to stop it from happening. Every day can bring something different actually, but my main job is looking at disease trends, causes of disease, and also I do emergency preparedness. A lot of my time is spent researching, looking at all sorts of different studies. There are a lot of good studies, there are a lot of bad studies out there, and part of my job is to figure out what's what.
In my position, I work with the tobacco prevention and control. I do child passenger safety, which is the car seat education. I also work with the Healthy Living Collaboration, which has to do with nutrition, physical activity, and tobacco control. One of the first things I do is get my computer fired up, see kind of what's on the calendar for the day. I might have to do some grant writing, a lot of paperwork and reporting, looking over the activities that have gone on in the previous year and making it make sense for our funders. I might also be a part of a staff meeting. Some days I'm in the office all day, but many days I'm out multiple times. We do all different kinds of things in the health department, in the health ed division. It's really amazing. I think people don't have a clue the kinds of things that we do.
I always wanted to do something healthcare related, but the only thing that I really knew about was health profession type of fields. And it wasn't until I had gone on a trip down to Ecuador with a medical agency and was working with the local population in Ecuador. And it was through that experience that I realized health education can make such a huge impact.
I started off at UWL, and I was going to be a business major. I was taking some economics classes, and I just thought, this really isn't for me. So I took, in my second semester, a personal health class. Got turned on to the idea of health education and this idea that you could educate other people about health. And so I looked at other health careers. I looked at nursing. I had a good friend who was transferring to another school to become a dietitian, so I kind of looked at that and I realized, patient care isn't really what I'm about. And so then I met with Gary Gilmore, one of the community health education professors, and he was talking about this field of community health education where the community is your classroom.
I remember riding in the car with my dad, and I was like, we were just brainstorming about what to get into, what to do. If you like everything, you like all kinds of stuff, what do you do? I didn't like math when I was in high school. I didn't like it. I never thought I'd do anything with math. I didn't really even know about statistics. What is statistics? I don't know. Didn't care. Eventually I reasoned math would be the way to go. It made the most sense. And I stopped thinking about, I'm not smart enough, I don't understand this. Look, I'm just an average guy, but what does that mean? I'm average, and that means I have the ability to reason, I have the ability to learn, and I can communicate, and I just have to apply what I know to something. It's simple. I knew what I wanted to do then, and I thought, that's what I'm going to do, then that's what I did.
When I first went to college, I was a voice performance major. I took that path probably out of a lot of pressure from a lot of other individuals. I got there, didn't perform very well my first semester of my freshman year, and discovered that there was a new major called Corporate Exercise Management, and it was relating to employee worksite health promotion or employee wellness. I knew instantly that's what I wanted to do, and I changed majors the next day.
I went to school for math teaching, so I was a teacher in Switzerland for 3 years at a boarding school. I coordinated many activities for the students. Through this organizing and planning, I really developed a lot of the skills that were needed for this job. So I decided to come back to La Crosse and get a master's degree in public health, which is what I'm still working on.
As I got more into nursing and taking the course, like the nursing courses and not so much the generals, I knew that I wanted to be able to go out in the community and provide services rather than in like one location like a hospital nurse.
When I was in college, I took a class. I remember it was called Sociology and Medicine, actually, which is a lot of what is the background of epidemiology. And that kind of got me hooked. So then I looked for schools of public health on the internet, and when I went to graduate school in epidemiology, it all just clicked. I enjoyed what I did. I didn't have problems studying. That's how I knew that that's what I loved.
If you're in college and you're currently undecided on your major, If you're in high school and you're even considering working in the health field and your interest is more in education and prevention, I would certainly encourage you to look at UW-La Crosse. They have a fabulous community health education program. Get as many experiences and exposure as you can through volunteering, whether that would be through the American Red Cross, the American Cancer Society, American Heart Association, any of the local agencies that we have. Expose yourself because the field of community health education is very, very broad.
Public health is important is because it impacts all of us. There's so much variety and so much opportunity in this field that the career can be what you want it to be.
I love being a public health nurse because I like stepping outside and knowing that things are safe and healthy because of public health.
I get to see lots of people on a daily basis. I'm helping people stay motivated, so that's great.
I'm exceptionally passionate about what I do, and I wouldn't do anything differently.
Public health for me is everywhere. It's in everything. It's what we do.
In a small way, I'm helping to make our community a better place to live. I get to make a difference.